got Chad here to say a couple words. He's got some banners to distribute if you'd like to hold those. There's some great messaging. And then I've got Kay to describe the route. So,
got lots of these. My name's Chad.
Hi, Chad.
Howdy. So I'd like to explain just briefly the strategy that you see, the sign, the community immunity, unity through community immunity. What we're asking here, and let me back up one sec. I have a little different view. I'd say we need to give our leadership, our government, locally, and the Sanford leadership the benefit of the doubt in this way. They are being asked to manage their risk and protect people. They're being asked to do it with not all the information. Who knows what information is missing? How many of us are immune? Why don't we know exactly that? Why isn't it on the dashboard? Why are they not calculating the total for community immunity on every dashboard in every state? Serology is cheap. You can have an antibody test, full retail is $50 at Avera or Sanford. If you are antibody positive, if you hadn't recovered, if you had a positive PCR, you are what we are calling COVID-19 recovered. There's a line being drawn between us, the vaccinated and the unvaccinated. It's an artificial line.
Absolutely.
There's a whole other group in the middle, the unvaccinated but the immune. And we need to know, why is no state calculating this? Last July, Sanford said 6.8% of the 6,000 they had administered were already positive. Last August, Minneapolis, they said 8.8% were seropositive. That's before the big hump in November. The suffering that hump represents, we all understand it. It's touched each and every one of us, right? We don't dismiss it. But it also represents a large portion of our population that were infected and recovered. Our strategy is to do the serology in South Dakota. Call your representatives, call your city council, call your county commissioners, call Kristi Noem's office, call Mike, call John, call Dusty, say, why isn't it being done? Voluntarily, of course. But if we can get a statistically significant sample, and we know what the number is. 3 weeks ago it was 20% according to JAMA. Nationwide. We know we followed a little bit of a different policy last year, right? Technically, we followed the 2019 World Health Organization plan that was put in place for a respiratory flu pandemic. But we did shut the schools in addition to that. We did it a little different. I bet it's higher than 20%. What if it's 40? What if our vaccination rate is 50, add 40, or add 30? Why don't we know? Why aren't they telling us? They operate in the shadow. Not these folks. We're giving them the benefit of the doubt. We want to give them more information. We want to give local leaders more information. We want to be able to make these decisions, and maybe we even do it and lead the country with science. Thank you.